Memorial Imaging Women's Center locations provide cutting-edge technology. A mammogram is an X-ray of the breast. It's also an invaluable tool for early cancer detection. Screening mammography is used to detect breast changes in women who have no signs or symptoms of breast abnormalities. The goal is to detect cancer before clinical signs are noticeable. The average woman should begin her annual screening mammogram at the age of 40. If there's a family history of breast cancer, screening should start much earlier. Your physician can determine the appropriate age for you to establish your baseline mammogram and begin with annual follow-ups. Our imaging centers deliver cutting-edge technology that produces only 3D screening mammograms. Called tomosynthesis, or TOMO, these images can be viewed one layer at a time and as a full 2D composite. Each breast tissue layer is examined carefully for any potential abnormalities. All our mammograms are conducted by a breast-dedicated technologist. 3D mammograms produce higher quality breast images with less recalls, enabling potential earlier cancer detection. 3D mammography produces 1 mm slices of the breast tissue for more thorough examination. All breast mammograms are interpreted by a breast-dedicated fellowship-trained radiologist. Should your screening mammogram show an area of concern, you'll be referred for additional tests, including a diagnostic mammogram, which is used to screen high-risk patients, or patients that have an existing abnormality. This 3D test includes a greater number of images and angles. To prepare for your 3D screening mammogram, your doctor may recommend that you schedule the test for a time when your breasts are least likely to be tender. If you haven't gone through menopause, that's usually during the week after your menstrual period. Your breasts are most likely to be tender the week before and the week during your period. Make sure you bring a copy of your prescription, your insurance information, and a picture ID. If your last mammogram was taken at a Memorial Healthcare System facility, your records are stored and accessible from any location. If you have prior mammogram images and reports obtained from non-Memorial facilities, please bring these images and reports on a CD. We recommend that our radiologists have access to past images for comparison. Do not use deodorant before your mammogram. Avoid using antiperspirants, powders, lotions, creams, or perfumes under your arms or on your breasts. Metallic particles in powders and deodorants could cause inaccurate readings. At Memorial Healthcare System, we value your time, and we make every effort to ensure that your appointment is timely and easy to schedule. You have the option to fill in all your medical information before you arrive by taking advantage of Memorial's My Chart portal found on our website. You can also enter your information at one of our women's imaging centers using dedicated, turnkey sign-in tablets used exclusively by our screening mammogram patients. A screening mammogram is non-invasive and quick, often taking no more than 20 minutes. Once you're moved into a mammogram room, you'll be asked to remove all upper clothing and any jewelry. You'll be given a gown designated for medical exams and procedures. A breast technologist will place the breasts, one at a time, between two plates. One of the plates takes the image, and the other keeps the breast in place. The technologist will take images top to bottom and side to side of each breast. While the breast is in place, it is compressed to keep it stable and to provide a better image. If your procedure is a 3D diagnostic mammogram, the process will likely take a little longer as the breast technologist will be taking multi-angle images of each breast. During any mammogram, you will likely feel a little discomfort, which is normal. Our breast-dedicated technologists are trained with the latest technology, which produces a more comfortable experience to minimize any discomfort. All images will be stored and available at any Memorial Healthcare System facility. Your test results will be shared with your ordering provider and will be available to you within 2 to 3 days. Patients also have access to their report using Memorial's My Chart portal. The majority of our diagnostic mammogram patients receive results the same day, often before leaving their appointment. When you're ready to schedule your mammogram and you have your physician's prescription, simply call Memorial Centralized Scheduling. An appointment can be made at your choice of Women's Imaging Center locations. You will also have the option of scheduling directly online. Your doctor can also schedule your mammogram, often the same day. Our Tomo 3D screening is faster and produces more accurate results. Images are sharper and more detailed. This system produces fewer false positives, which means less retesting is needed. Most important is the potential for earlier cancer detection and treatment. Every Memorial Women's Imaging Center is a breast imaging center of excellence, ACR accredited, NAPBC accredited, and every radiologist that analyzes screening or diagnostic mammograms is breast dedicated and fellowship trained and board certified. At Memorial Healthcare System, we offer price transparency because we believe the cost of healthcare should be available before a patient makes a choice.